Hi, hello, welcome to the channel. Welcome back, welcome back. I'm Dr. Sylvia. This is Ask Away Health Live. Thank you for joining me for another 30 minutes with Dr. Sylvia. So, how are you doing? How are you doing? Let's see who's online. Give me a moment. I'm just going to check that my sound is doing good. Bear with me, guys. So how are you doing? Thank God it's Friday. I literally feel that in my bones. Thank God it's Friday. It's been a long week, guys. How have you been? How's it been for you? Okay, so if you're joining me live, then we are talking about pregnancy scares after using the birth control pill. So if that is a topic that you want to learn about, and by the way, I have had lots and lots of messages, questions on the channel just this last week about this subject, which is why I chose to put it on our live. Oh, yes, we've got sound. Good, we're all good. Okay, I've had lots and lots of questions around this topic this week and last week. So many questions. People who've used the pill, the emergency pill, Postinor or Postinor 2, Take Action Plan B, and so on, or Ella, and I'm not sure if they've taken it right or just want to know if it's going to work, and just the scare. So that's what the topic is about, really, dealing with those questions, because there's so many of them. I can't really settle down to answer all of them in detail, not because there's so many. Well, there is that, but also because to answer these questions, you do need some more information, which this is not the platform for that purpose. This is just to provide education. So guys, I do have a health information service. I do have a health information service, an email health information service on the website askawayhealth.org, where you can go straight to that service. If you go onto the webpage and click on, let me share it with you so you can see what I'm talking about. So we're going to askawayhealth.org, and I will show you what I mean and just how to access that information, so that if you've got a question related to your health and you want some clarification, you want some guidance, you want to speak to me about it, it's very, very easy. So let me share my screen and I will show you how to do it. It will just take me 2 ticks and I'll show you what you need to do. So we're sharing screen. We are going to, where are we going? This window, yeah. Okay, so let me share my screen. So hopefully you can see my screen. So this is askawayhealth.org. This is our website, and there's lots and lots of information on this website. There's lots and lots of useful stuff. But what I want you to do, if you want to send a question, is scroll down a little bit. So just go down a little bit where you have this. You can see my picture, see my smiley face. Welcome, friends. Click here to ask me a question. Click that and get rid of that. And that takes you to our email health service, email Dr. Sylvia, and just read through. Very straightforward process. Put your details in, as much information as possible about what you want to know, as much as you can, and send that off to us. And we will respond to you. Myself or one of my team will respond to you. We do appreciate a little donation because it does take time, and we dedicate, we commit people to actually look through these inquiries and make sure we're providing you with the best information. So anything that you can give to us that would help us to build the site and make it accessible for everyone will be much, much appreciated. Okay, guys, so that is if you want me to answer a specific question. But yeah, I got tons of questions in the last few days, and I've just pulled out a few that I'd like to answer online on this channel, on this live stream today. So if you're just joining, thank you. I hope you're well. I hope you guys are doing well. Where you're watching from, let me know in the comment section. Say hi. So let's just get straight into it. So I'm going to be sharing, I'm going to be putting up the questions. I've prepared them ahead, just put them in a sort of reader-friendly format so that we can go through them together. I'm going to just talk through what I would suggest, because don't forget, we don't have all the information. But I think it's helpful to go through the ins and outs around using the pill, around the menstrual cycle, around ovulation. I think that's useful, and I'm sure it will help somebody. And if that happens, then my job's done. If that was one person, then my job's done. Okay, so the first one. Oh, by the way, guys, I rarely do this. Please don't forget to like and subscribe. If you've just clicked on this and this kind of information rocks your boat, what you're looking for is a place to find information about women's health, men's health, sexual health, family health, so that includes kids and pregnancy, general health issues, this is the place. You've come to the right place. Simple health information online. Please give us a like and consider subscribing to the channel. We'll be so happy to have you in the family. So please like the video, consider sharing it with a friend. And if you're watching on the replay, exactly the same, please do support us. Thank you so much to everybody who's felt that we've provided value to them. Thank you so much for your comments. Much, much appreciated. And let's get into it, guys. So the very first one I've got on queue today, this is the first question. So I'm going to be reading it out and we're going to be going through it together. Yep. Okay, so hello, I need help. I had my period on the 7th of February, ended on the 13th. I had unprotected sex with full ejaculation on the 19th and took a plan B 12 hours later. I'm not sure when I was supposed to ovulate because my period is irregular. I'm currently experiencing cramping. Is this due to my ovulation, plan B, or implantation? I like this question because it does reflect on, the different issues around the menstrual cycle and the challenges that you sometimes have. And if you've watched any of my videos around the emergency birth control pill, you'll remember that I always tell you that there's really no sign. There's no sign to tell you whether or not the pill has worked or not. So don't stop looking for the sign. There's just no sign. What you have to do is wait the appropriate time and then do the pregnancy test as early as possible. And that's usually a couple of weeks, 2 to 3 weeks after the time that you had sex. Because if you have ovulated, that is around, and if you have ovulated and your egg has met with your partner's sperm, then and fertilization has happened, it is around that time, 2 weeks or 3 weeks down the road, when the egg will have implanted and then the body starts to produce the hormones, which you can then detect in the urine test and the blood test. So there's no point sort of panicking 2 or 3 weeks earlier because there's really nothing that can tell you. You have different symptoms, but they just don't tell you. Okay, so basically, we can work out around the time of her ovulation because she said she had her period. Oh no, actually we can't because she's told us that she has an irregular period. So we can't really say particularly, we can't estimate when she had her period. Beg your pardon, we can't estimate when she ovulated. All we can do is just say it might happen around this time or the other. We just don't know. But she says that they had intercourse on the 19th and took plan B 12 hours later, which is what you're supposed to do. You're supposed to take it as soon as possible after sex. Within 72 hours is recommended. So she's done all the right things. And so she's just going to have to wait until she does a pregnancy test. Now, she's experiencing cramping. I don't know when, I can't remember when this actually came through. But if it's within a couple of weeks that she's experiencing cramping, it might be a side effect of the pill. It might be. I would expect that to happen usually within the first few days of taking the pill, really, but it can still happen at this stage. So I can't tell you whether this is because of the plan B or because of ovulation or even implantation, because you're right to ask. If you calculate from the 19th when she had sex and move forward 2 weeks, she could be implanting around that time. And some ladies do get implantation cramping. Not all, but some do. So it is very easy to mistake implantation cramping for it's very easy to mistake pain or discomfort in the abdomen for implantation cramping when all it might be is your period about to start. So in this particular instance, for somebody like this, instead of going through this kind of scenario every single time that you have sex and you're not prepared to deal with pregnancy, then you should be on a regular contraceptive method. So my answer to this question is, I can't tell you if it's ovulation. I can't tell you if it's if it's the pill side effect or if it's implantation, because one, your cycle is not regular, so we can't predict or estimate when you could have been ovulating. We don't know. Okay, we can't tell you if it's implantation because we don't know whether you ovulated around the 19th and then had an egg fertilized after you had sex. We don't know that. So basically all we can do is wait until your pregnancy test. It is a pregnancy test that will tell us, and the earliest that you can do that is within 2 to 3 weeks after you've had sex. So guys, I'm sorry that this keeps blinking on and off. But I just wanted to make sure I kept it on screen so anybody who's just joining can read and see what we're talking about. Okay, so if you're just joining, hi, welcome to the show. Welcome to the lesson. We're talking about pregnancy scare related questions around the emergency birth control pill. And I'm just going to go through a few questions I've received in the last 1 or 2 weeks and hopefully help us learn, educate us about different things around that. So this is question number 2. Hi, doctor, I've been cramping and getting back pains. My breasts hurt. But I went to the doctor who tested my urine and they think I've got a UTI. I thought I'm pregnant because I got all the signs. What could be the problem? Okay, so if you have pregnancy signs or symptoms, sorry, if you have symptoms, and there's so many different symptoms that suggest the woman is pregnant, and none of them actually is only found in pregnancy. What I mean by that is things like tiredness or sore boobs or tender nipples or headaches or nausea and vomiting. They can happen in so many other different conditions. So you can't say that once a person is feeling tired, then definitely they must be pregnant. So you can't say that. But it's enough if that is present and you have missed periods, it's enough to think, maybe I am pregnant. And if the urine test is negative, I would expect your doctor to run a blood test. So you could ask for that. I don't know what the problem could be. There may not be a problem, really. There may not be a problem. There may be that you are pregnant and the urine test didn't detect it, but the blood test called. Okay. Now, if the blood test is negative and you're still getting all these symptoms, then it looks like your doctor needs to sit you down, get some more history, take some more information from you. Any other changes, any stress? Are you on any other medication? Is there anything else that's going on that might explain these symptoms of the cramping, back pains, and your breasts? Once your doctor is happy that your blood pregnancy test is negative. So that's what I would say. I don't know what the problem could be, but I do think that it's not enough to say that because your urine test is negative to completely discount pregnancy, particularly if you're having symptoms and if you've missed your period. Okay, so that's question number 2. That's the response to question number 2. So let's go quickly to question number 3. Right, so this is question number 3, and this is a lengthy one. Let me just take off the banner at the bottom. Here we go. So this is question number 3, and let's read it together. Ovulation is regular on the 14th day. Then she tells us a bit about herself. She's a breastfeeding mom, been breastfeeding for 5 months. She's got a regular cycle, and and her cycle has been regular since 2 months after giving birth. Okay, so this is a regular cycle and ovulation on the 14th day. So she says, what if I have sex on the 12th at midnight? So that's 12/13th, and then I take Ella pill right the next day, 9 hours after sex. I know it should work. Hopefully, if ovulation didn't happen, well, what is the percentage? Let me just take this off because I think it might just be triggering some people. It just keeps flicking. It keeps flickering so much. So that question was, she's got a regular cycle. She's had sex. I think what's relevant about that question is she says her ovulation is about the 14th. And she tells us that she's had sex 12/13th. So she's within the fertile window. Remember, the fertile window is that day of ovulation plus the days leading up to it. Sorry, the days leading up, 4 days leading up to ovulation day. And in some cases, the day after, because the egg can survive 24 to 48 hours. So she has had sex inside her fertile window. The chances of getting pregnant then are very high. That's the highest chance of getting pregnant on the day of your ovulation, the 4 days beforehand, and then possibly the day after. So, but she says she took Ella 1. I only have 2 issues with her taking Ella 1. And because it's a very effective emergency birth control pill, very effective, even more effective than the Plan B, because the Plan B will not work after your LH surge. And if you wonder what I'm talking about, the LH surge, please go and check out my video. I'll put the link in the description. But I do discuss the LH surge where we talk about will the pill work if I take it after ovulation or before ovulation and all that. So I've got a couple of videos on the channel already answering that question. In this case, Ella can actually work after the LH surge before ovulation has happened. There's a little bit of a space, a bit of a gap, some hours between when that LH, which is the hormone, when it surges till when ovulation and the release of the egg actually happens. So while Plan B will stop working before LH surge, Ella continues to work after the surge before ovulation has happened. That's how the 2 drugs are a little bit different and makes Ella more effective because Ella gives you a lot better cover But so that's Ella's a good birth control method, but it's not recommended in breastfeeding. That's the only issue I had with this, because she mentioned that she's 5 months breastfeeding, and so if Ella can come into the breast milk, and the studies tell us we don't know what effect it could have on the baby. So that's the only place I'd be careful when it comes to Ella in this lady's story. But the other thing as well is, she's taken it in the fertile window, pretty close to ovulation. There's a chance that it could work. There is a chance. Only in the laboratory can we tell how soon you took the pill, and how much time it is from when your body digests it and it gets into the bloodstream to where ovulation happens. It's only in a laboratory that you can actually assess all that. So we can only estimate. And that's why I said nobody should ever think that these pills, whether it's Plan B or Postinor or Ella, they're not 100% effective. They do have some level of failure, because that's just the nature of the medicines that they are. So for this question, let me see, is it this one? Yes, for this question, she's hoping that ovulation hadn't happened by the time that they had sex, and that she took Ella just at the right time. She's asking the percentage. We don't know. There's no way of measuring the percentage chance or risk. So for somebody like this, I think she could have prepared better. She could have been on a regular form of contraception, because she's breastfeeding. That doesn't mean you can't have a birth control method. You can. The lactational amenorrhea method, plus another type of maybe a barrier method for somebody who doesn't want to have hormones. And if you don't mind having hormones and you don't have any medical reasons why you can't have hormones, then of course you could go for the other methods, the oral birth control methods. The mini pill, for example, is something that you could have, and you can continue to breastfeed with that. So I think she could have avoided all this heartache and all this worry simply by doing that. So that's question number, was that 3? That was 3. Okay. Welcome back. Welcome to the channel. If you're just joining, hi, where are you watching from? How are you? Aren't you happy it's Friday? I am so happy it's Friday. I've been looking forward to the weekend. Okay, hi doc. I took the pill 2 days to my ovulation. Will it work? So on the back of what we've just been talking about, yes, I think this has a good chance to work. 2 days to ovulation, if she's taking it, as soon as possible after, she had sex. Why? Because 2 days to ovulation means that if it's a Plan B, for example, perhaps the LH surge has not yet happened. So there's a good chance that this will work. Okay, so the key things there is taken before ovulation, remember, because that's when the pill is most effective. You take it before ovulation. If you take it 2 days before, you've got a very good chance of getting the pill in before the LH shoots up, surges, and that makes it more likely to work. So yeah, I think you've got a good chance. Will it work? Yes or no? I can't say blanket yes or no, because like I said earlier, none of these pills are 100% effective. They do have failure rates, but I think there's a very, very good chance that this pill will work, because you've taken it 2 days to ovulation. You've got a good chance. And as many as people get concerned about the emergency pill, and I do think if you're having to rely on the emergency pill so often, particularly if you have to take it more than once in a cycle, then it's reasonable to think about an alternative, isn't there? The regular birth control. And I think it's worth thinking about it, because there's so many different methods, both hormones and non-hormones, that you can decide which one will fit yourself, your person, your medical background, and your lifestyle. So it's worthwhile sitting down to think about which option works best for you, instead of coming at a panic after having sex that you've not, without any proper protection, and you're worried about whether it'll work or not. Nobody's going to tell you if it can work, only the pregnancy test. If there's somebody out there saying, oh, they can tell you in advance, they're lying to you. They can't. We don't know. It's the pregnancy test that will tell us. So whether you've got, even if you say, oh, my breast is hurting, and sometimes the hormones in the pill could affect you that way. If you're having cramps in your tummy, the hormones in the pill could do that. So you can't say it's pregnancy until you've done the test. That's just the way it is. Okay, so we've done that one. So we're on number 5. We're making progress. Very good. So next question. I did an abortion, and 2 weeks later, I had unprotected sex. I took Postinor 2, and I'm scared I'm pregnant. Is it possible I'm pregnant? So sister did an abortion, and 2 weeks after. So let's think about this. What are the issues? So she's had an abortion. So what we need to be thinking of is how soon or how early after this abortion is she going to ovulate? That's the question, really. Could she possibly have ovulated by the time she had sex 2 weeks down the line? It's possible, probably unlikely, but it is possible. We usually say following an abortion or even a natural delivery, we usually say 4 to 6 weeks for the next period to arrive. But it is possible that you could ovulate earlier. See, that's why it's useful to start a birth control method as soon as possible. Because, yeah, you might fully recover from the termination or the abortion within a few days. You might be fully recovered, depending on whatever method that was used. That is, you're feeling better, is what I mean by fully recovered. And so it's possible that your body, your natural balance goes back into its usual pattern. So your body starts producing the hormones that will trigger your ovary to start ovulating. And it's possible that within 2 to 4 weeks after the termination, you are naturally ovulating and releasing an egg such that when you have sex, pregnancy is possible. So yeah, cautiously, I would say it is possible. I would say it's possible. She said she took Postinor 2, which I think was the only sensible thing that you could do in this instance. Is she scared? Well, I understand the being scared bit. Unfortunately, we can't give you any reassurance until, like I said, 2 weeks or 3 weeks after you had sex, do a pregnancy test, because that's what will tell you. That's what will tell you. And the only way to avert this scare and the only way to avoid being in this position again is regular protection. And really, sometimes I wonder, because I would sit this person down and say to them, you've really literally just come out from an abortion, and then 2 weeks down, you're exposing yourself again. So what happens if you're pregnant? Are you going to go for another abortion? Come on. That has so many side effects that can put you at risk. And there are potentially side effects, especially if this termination was a surgical termination. And in many parts of the world, this is what happens. A DNC, dilatation and curettage, is what happens, and can carry with it so many complications, which may include things like fertility problems in future. And sometimes when it's done poorly, when it's a bad job that's done, can lead to infection that can cost a woman her life. So I think this is very risky behavior. Let me just put it up just in case you're watching on the replay. This is the question: an abortion, and then 2 weeks later, unprotected sex, i.e. potential for another abortion. This is not right. This is not right. Please don't do this. Please don't do this. Practice, be safe. Practice safe sex. Think about contraception. Keep yourself safe. I mean, why would you do this to yourself? Next question. I took the pill and bled for a few days, and I haven't gotten my period for 22 days. Let's think about this. So I took the pill, bled for 2 days. So you took the pill and bled for 2 days. There could be a number of reasons for that. One being the side effect of the pill, totally unrelated to your cycle. It could be the effect of the pill, or it may be an effect of the pill on your cycle. The cycle brings your period forward or delays it, and then you have the bleed. So that's the first bit, that bleeding she had for a few days, and then she hasn't got her period for 3 weeks plus, just 3 weeks. She's not seen her period. And that might be because when she took the pill, that bleed she had for a few days was a period that had come forward. It's possible. We don't have any other dates before, after to help us clarify. She says, I even got my blood test done for pregnancy and that was negative. Is there something to worry about? So she's had a blood test done, and the blood test, we can sort of be reasonably happy with the blood test that she's not pregnant. That sort of gives us some reassurance, I think. And so we can sort of focus on other things. Now, if the question is, well, why hasn't my period come back for 22 days? Those of you guys who come onto my channel and who sort of follow the birth control videos that I do will know that I've said it before, that this is what the pill could do. The pill can delay your period. And in many women, it can delay it for more than, in most women, really, when you take the pill, your period will come around the same time. In some, it can bring it back, it can bring it forward a little bit. So if your period was supposed to come on the 30th, taking the pill could bring it forward a week before, a week earlier. But there is a big group of women whose period is delayed beyond. And so you're sitting there waiting. And in fact, I think I'm going to put it on my community post, because I got somebody who sent me a message. In fact, let me see if I can find it and share with you guys. I don't know if it's going to be very easy to do that, but I did get somebody who left me a comment about their experience with the pill. And I think what she wanted to do was just to encourage some people out there who are panicking about very, very lengthy delays with their period after using the pill. So let me just see if I can find what she said. Let's see. Let's see if I can find. If I can't find it now, then I probably will do a screenshot and put it on the community. Put it as a community post, and then you can look at it. But when I read that, I think she was just sharing it because she wanted to. No, I can't see it. That's a shame. Yeah, so I think if I remember, I'll just screen grab it and then share it with you. Okay, so yeah, so it's possible that you could have very lengthy delays. Now, so it could be a couple of weeks after the expected date. So you might be waiting 2 or 3 weeks and then the period comes. You might be waiting a month or longer. Those that tend to wait a month or longer, one of the things that could happen is if you use the pill more than once in your cycle, it can mess up your natural balance of hormones. And so you have irregular periods and delays until things eventually settle down. That's one of the downsides of using the emergency birth control pill more than once in a cycle. So just to be aware of that. But the key thing is that if you've done a pregnancy test, it's negative, you don't have any other symptoms, and you don't have any other problems, and it's been delayed for about 22 days, it's likely an effect of the pill. And it's better that you calm down, stop stressing, make sure that you focus on your wellness, eating all right, doing exercise as you can, and if possible, avoiding any more hormones until your cycle just comes back to normal. But this is possible. This question, I don't think she's got anything to worry about with this information that she's giving us, which is very limited, but I don't think there's much to worry about. If she does have any other symptoms, then she needs to sit down with her doctor to look at those symptoms properly, and then you can decide if there is something to worry about. But just given what she said, her test is negative, it's a blood test that's negative, there's nothing else going on, it's likely an effect of the pill, and the cycle will come back. And let me just mention, for those who ask, what can I do to bring my period back early? There's nothing you can do apart from stop worrying. There's no medicine that we can give you that will bring your cycle back earlier than it should. Anything that you're taking to try and provoke bleeding is just going to mess your cycle about. It's better that it's left well alone to recover naturally in its own time. So that's what I'd recommend for this lady. Question number 7, my woman. This is from a guy. I do get a lot of them on the channel. If you're just joining, hi. Thank you so much for joining. Thank you for watching. Please give this video a like and consider subscribing to the channel. Please, that will really help us and encourage the work that we're doing. So we're talking about pregnancy scares after the emergency birth control. And this is from one of the guys I got to get on my channel. He says, my woman was ovulating when we had sex on the 13th. I came inside her and we also made out on the 14th. She took the pill in the evening and we made out the next day, the 16th. Will she get pregnant? Okay, so ovulating so she was ovulating. This is the only problem I have with this. This is the only problem I have, okay? She was ovulating, so you're nicely inside the fertile window. Of course, she's likely to get pregnant. However, she took the pill in the evening of the 14th. Now, 14th is the day after ovulation. Remember that we said the pill is most effective when it's taken before ovulation. They're already on slippery ground at this point. I have to let you know, because you've had sex without protection inside ovulation period. Yeah, that's asking for pregnancy. And the best way to protect or to prevent the pregnancy is by taking the pill in good enough time before ovulation happens, or she's on a regular birth control method, or you're using a condom or some other male or female condom, for example, or some other birth control method. That's the only way to prevent a pregnancy. So that's the first thing. The other thing I think is relevant is they still made out the day after she took the pill. And remember that pill, okay, that pill that you took the day before you made out is not going to protect you from the pill from the sex you had on the making out day. If that makes sense. Let me say it again, okay? The best way that the emergency birth control pill works is when you take it as soon as possible after sex, as soon as possible after that episode of sex, within the day, okay? Because we say within 72 hours of that episode, it's likely to work. Now, if you had the pill yesterday, and because you guys had sex yesterday, okay, fair enough. And then you have sex again today, say 24 hours later, there's still a very small chance that the pill you took earlier may have some benefit. But there's a very big chance, okay, that the sex you had on the second day has produced a new load of sperm that are going to survive in your womb for 5 days, i.e., one more day longer than the sperm that was released the previous day. Just think about it. It's pretty straightforward. Just think about it. So by relying on the pill you took on the first day, it's not going to protect you from the one extra day of your sperm, your partner's sperm being alive in your vagina or in your womb from the second time that you had sex. And that is why you're advised to take the pill as soon as possible after sexual intercourse. So don't sit there and think, oh, we had the pill on Monday, we're good, when we've had sex on Tuesday night. You're not. There's a risk of falling pregnant because that pill that you took on Monday only provides you the protection up to 5 days from Monday. Okay, the sex you had on Tuesday, you have sperm that's going to be alive for 5 days from Tuesday. Okay, so let's just refresh. So will she get pregnant? There's a possibility that she could get pregnant. Yes, number one, because she was ovulating when you guys had sex. Even if you took the pill the very next day, the pill is supposed to work when you take it before ovulation. Yes, there are other ways that the pill could work, for example, by preventing implantation and by preventing fertilization, yes, but to a less extent. So it's not as a reliable way of the pill working. So I think it's a big chance. I think it's a big risk. Now, with all this said, guys, please take the pill if you need to at any time in your cycle. Okay, I just think one of the things that are more important, I think is really important for people who come really anxious and panicking about could I be pregnant, is if it's going to be such a big deal, a big consequence, then think better before you actually go ahead and do the thing. Plan it better. Regular contraception, or think of the method that you're going to use that will be more effective for you, or think about the time that you're actually going to do it, because your window is from ovulation and the 4 days beforehand and the day after. So think about these things and use a condom. If this means so much to you that you're going to cry and it's going to upset you, think it's going to be considerably life-changing, that you're not ready for, then it's good practice. It's being safe and smart to think about the consequences. Okay, that's my response to that one. And the last question, friends, what is the possibility of pregnancy from pre-ejaculation during ovulation? Okay, so first of all, the possibility of pregnancy during ovulation is high. In the first instance, let's get that out of the way. So it is high. That's the highest time. Ovulation, during the ovulation part of a woman's cycle, that's the time when she's most likely to fall pregnant, as well as during her fertile window, which is the 4 days before ovulation and sometimes the day after. Okay, so the risk is high. But what makes this interesting is because of the pre-ejaculate. And many people think, oh, pre-ejaculate is safe and so on. Well, what is pre-ejaculate? So is that liquid that a man produces when he's aroused, before he orgasms, before he climaxes, or before he comes, okay? So that's why it's called pre-cum or pre-ejaculate. Does it contain sperm? Technically, it doesn't. When it's made from the glands, fresh from the glands where it's produced in the man's body, it doesn't contain sperm. Its job actually is just to lubricate and to clear the path within the channel where the cum is going to pass through the penis. That's its job. It's to lubricate and just clear the channel. Why is it clearing the channel? Because the guys also wee from the same channel where they come, okay? So the wee is acidic and that could kill the sperm. So your body is so clever, and when it knows that, okay, this guy is aroused and he's going to, his sperm is going to ejaculate in a short while, it produces the pre-cum to clear that acid, from the urine. So that's what the job of this pre-cum really is. And when it's doing that, it's possible, and I know this is theoretical, but it's always possible that the pre-cum along its journey can pick up sperm, because these channels are connected from where the glands where the sperm is being produced, the tissues where the sperm is being produced, and the channels where the semen is coming from. They're all connected. And so it's possible that some sperm could get into the pre-cum. So the question is, or if you're thinking about pregnancy or you're worrying about pregnancy, I would recommend that you consider pre-cum to be similar in that respect to semen. That is the cum that you get when you ejaculate. Okay, so to a lesser extent, it doesn't contain a heavy, healthy load of sperm, yes, but it potentially could. So to answer this question, which is about the possibility of pregnancy from pre-ejaculation during ovulation, it is possible. It is possible because pregnancy during ovulation is highly likely, number one, and because two, pre-ejaculate could, that's pre-cum, could contain sperm, because while it's traveling along the channel where the sperm is going to come, it might just pick up a few sperm cells while it's traveling, because they're not closed off, or they're not just blocked off and shut off indoors. These tissues are connected. My friends, this is these are the questions. We've overrun by about 5 minutes, but that's fine. These are the questions I thought were useful to gather. There's so many more that I get on the channel, and please send your questions. When I can't respond to them because either I need more information, or it's not something I can tell you what to do. I'm not your medical doctor. I'm here to provide education. But when it's something that we can probably provide you with a bit more education and give you some direction, I will ask you to come to the website, and I've shared it with you guys earlier. So if you're watching the replay, please have a look at how to get onto the website and to send your question. So, but your questions are always welcome. Our job, what makes us happy, is being able to provide people with direction, explain things that are not clear, and just show you what you could be doing and the different options that you could have for living a healthy and safe life. Guys, thank you so much for spending time with me. I'm going to let you go off to go and enjoy the rest of your Friday and have a very good weekend. And I look forward to seeing you guys again soon. Bye-bye.